You're listening to Podcast to Practice, brought to you by Springer Healthcare IME. Podcast to Practice brings you expert-led independent medical education discussions, inspiring healthcare professionals to maximize their learning and make measurable changes in their own clinical practice. This podcast is part of an independent medical education program entitled Journey to a New Era for Alzheimer's Disease, and is supported by an independent educational grant from Lilly.
Hello, my name is Charlotte Teunissen. I'm professor in neurochemistry Amsterdam UMC in the Netherlands. I'm here at the ADPD conference in Lisbon, and I've attended a very interesting session which was about novel biomarkers. One session that I want to dive a little bit deeper into is one presentation about a novel biomarker assay to detect multiphosphorylated tau. So normally we measure one phosphorylation isoform of the tau protein, for example p-tau 181, 231 or 217. But this researcher, Anna Lydia Voidala, she developed an assay by which she could identify and detect the levels of tau proteins that are simultaneously phosphorylated at two sites. So, for example, at a phosphorylation site 231 and 217. And she showed that using this assay on the Simoa platform, that she was able to have a better discrimination with area under the curve of even 1 between AD patients and controls. And this was validated in the independent cohort. So all in all, this looks very promising to measure such multiple phosphosites on just one specific protein. Other presentations were addressing the effects of confounding factors, because it has been shown that several confounding factors like comorbidities or BMI or age could influence the plasma biomarker levels. These influences were not so important when we measured CSF biomarker levels, but now with the plasma biomarkers being in contact with multiple organ systems, this may be very important. It has been shown already that BMI can affect neurofilament light levels. Also, the age is a very important factor. And in addition, chronic kidney disease could lead to higher levels, even as high as the increases that you observe when someone is amyloid positive compared to the amyloid negatives. So several studies were presented in that session, and they showed confirmation of the basic concepts. So we saw an effect of chronic kidney disease, BMI and age, and in some studies it was a bit less and others a bit more. But I think the factors that really stand out is age and BMI maybe. Of course, there was significant effect, but whether this leads to a huge effect in the decision making for a patient, that's not so easily translated. After all, we have to understand that all the studies were done in large cohorts, so significant effects in large cohorts may not mean an effect in clinical, everyday, individual patient decision making. Very important factor that was validated over and over is the effect of chronic kidney disease. It was shown that mostly in those who have really more severe chronic kidney disease, there might be some influence of the kidney disease on the biomarker results. How to deal with that in clinical practice, we don't know the answer yet, but that's to be followed up.
Thank you for listening to Podcast to Practice, brought to you by Springer Healthcare IME. For more information on our educational programs available, visit ime.springerhealthcare.com. Thank you for listening to Podcast to Practice, brought to you by Springer Healthcare IME. For more information on our educational programs available, visit ime.springerhealthcare.com.